This is the North Andover Board of Health's virtual meeting, Thursday, October the 22nd, 2020. It's about 7:03 p.m. I'm Joe McCarthy, Board Chairman. Roll call, starting with the Board of Health members. Michelle Davis, clerk.
Here.
Daphne Alva LaFleur.
I'm here.
Dr. Patrick Scanlon.
Here.
Dr. Max Tilson.
Here.
Department of Health, Brian LaGrasse, Director.
Here.
Stephen Casey, Inspector.
Here.
Callan Iverson, Town Nurse.
I gave her the night off. She's worked every night this week, so I made her sign off.
Tony Wolfenden, Department Assistant.
Here.
Okay, we have a quorum, so this is a call to order. Approval of minutes. Michelle?
The minutes from the September 24th, 2020 meeting have been reviewed, edited, and I make a motion to approve them if there are no further edits.
I'll second.
Any no's? Then the minutes for the September 24th meeting have been approved. Before we go further, I'd like to talk a little bit about agenda and minutes. They are available on the town's website. The agenda is prepared by the Department of Health Director, Brian LaGrasse, with input from his staff. And the Board of Health, usually through the chairman, but not necessarily. The minutes are written by Tony Wolfenden, the department assistant, critiqued primarily by Brian LaGrasse and Michelle Davis. Again, she's the clerk of the Board of Health. Then approved by the Board of Health. And I'm going over this because there have been some questions, as well as the discussion topics, which I'll discuss to a certain extent later on during the meeting. New business.
Before you get too far, Joe. Joe.
Yes.
Before you get too far, you have to read the disclosure statement.
Oh, forgot about that.
So see you in 4 minutes.
Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the North Andover Board of Health will be conducted via remote participation to the greatest extent possible. Specific information in the general guidelines for remote participation by members of the public and or parties with the right and or requirement to attend the meeting can be found on the town's website at www.northandovermass.gov. Members of the public who wish to watch the meeting may do so on their televisions by tuning to Comcast Channel 8 or Verizon Channel 26, or online at www.northandovercam.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately assess the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the Town of North Andover's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. If the public would like to participate, please email your question comments prior to or during the meeting to blagrasse@northandoverma.gov. That is blagrasse@northandoverma.gov. The question comment will be read during the proceedings and responded to accordingly. Thank you for the reminder, Brian. Moving to new business. Brian?
Yes, Joe.
Introduce the new hires.
Steve, you have that information with you? I was going to let him do it.
Yep. Yeah, I can do it. So we have 3 new employees working for the health department. We have Judy Sullivan first. She is the part-time public health nurse. She's been helping out Caroline a ton with planning for the flu clinic, getting ready for the flu clinic as well, and just doing vaccinations and flu clinics the past couple weeks. We also have Kim Cameron, who is a part-time nurse with us, and she's mainly helping with managing Maven information and also with Merrimack College. And finally, we have Kalechi Obika. He's a part-time health inspector with our department. He just actually started today. He's been helping me out with complaints related to COVID-19, for example, like mass complaints and things like that. And eventually he'll be able to help out elsewhere once we get him a little bit of experience. So that's just a quick synopsis on the new hires.
Yeah, so essentially, Joe, we've been going strong for 7 months now at this point. We've been keeping up as best we can, but at this point, with everything coming back around full circle, sports, schools, college, businesses reopening, obviously we're seeing an uptick. I mean, typically when you have an infectious disease like this, more interaction, more gatherings, more people out and about, there's more transmission. So to keep up with the contact tracing, with the complaints, with the work with the schools, all of the new guidance and new things coming out by the state, it's a lot. So we pulled in some part-time temporary employees. Part of the CARES Act funding, we had some money that we could kind of use to augment our staff to help us out and pick up some of the stuff that we weren't able to get to or we're starting to get behind in. So it's fantastic to have extra staff with us helping out. The Maven piece, which is the epidemiological software we use for contact tracing and isolation quarantines, is time consuming. So we brought in extra help for that. Merrimack College also brought in extra help for themselves as well to help us out with that on their end. So things are definitely moving along. Things have definitely seen an uptick. And we are doing as much as we can every day, all day.
Brian, in addition to these 3 temporary employees, and any thought of hiring more, or is this it at this particular time?
There is talk of hiring more, actually.
And any idea how long they'll be with us?
The employees we have now are part-time and temporary. We have them scheduled for a minimum of 16 weeks each. We will see what we have for funding beyond that. As of now, that the CARES Act funding goes through December 31st. If more money comes out after December 31st, we will have the ability to keep them on and or increase.
Thank you. Other questions, comments? If not, I'll move to the discussions. And as we see in the agenda, the discussion topic is just the COVID-19, as it has been for quite some time, and certainly should be, unfortunately, also for quite some time. But before this update on the COVID-19, I want to briefly talk about this and future discussions, because again, there's been some questions on who does what in our board and in our department. Now, the members of the Department of Health primarily discuss the regulations and their effect on our town. Also, in that there are 2 doctors on our board. And by the way, they want to be referred to by their first names. They'll primarily discuss the symptoms, the hospitalizations, treatment, cures, and so forth. And there will be a back and forth discussion and dialogue. The other 2 members of our board also work in the medical field, and they too will have input. At that, Brian and your staff, turning the meeting over to you at this particular time.
All right, thanks, Joe. Just give you guys a quick little update. Trying to get too lengthy or in depth with all of this, but as of today, we are looking pretty good. And like I said, we have had an uptick in cases. We have, right now we have 39 total active cases in town. 13 are attributed to Merrimack and 26 are in the town. The Massachusetts had 986 new cases today out of 18,000 tests. and 646 new cases out of 12,722 tests yesterday. So those are up from midsummer when we were getting about 200 a day. We were also doing less testing, but like I said, there's more interaction, there's more gatherings, things are moving inside, which is where this virus likes to transmit the most. So indoor gatherings is one of the things that we're seeing more and more of, and it correlates with the increase in cases. Recently, the state has been sitting at roughly about a 1.3% positivity rate, slightly up from last month, which was about 1.1 when I gave you guys the report. Hospitalizations have also snuck up. They're at 369 last meeting. They're up to 519. Still much lower than the peak numbers way back in April when they were in the thousands. But I'm going to keep an eye on this as flu season is approaching. So we have seen a slight increase in our numbers, slight increase in Merrimack cases as well. They had their little spike last month, but they're still seeing a couple numbers here and there. They have come down, but they're still there. There was another small little cluster at one of the dorms this past week. They have actually isolated the positive students, retested all the students, and quarantined the entire dorm. And they have gone remote for that specific dorm. Let's see. So like I said, the sports increase in gatherings outside of schools and increase indoor, sleepovers, summer parties, whatever it is. There's all things going on like that we have seen attributed to clusters. It's definitely important we continue being vigilant when it comes to this. We did a PSA today at NACAM. The superintendent, myself, and the town manager, Melissa Murphy Rodriguez, did a little 1 minute, 2 minute video just to reiterate some of the stuff, as well as talk about the closure of the high school going to the remote learning model for the next 2 weeks. We're still currently in phase 3, step 1, as we were at the previous meeting. So the sector-specific guidance, like restaurants and gatherings, stayed from the same as last month. We are still encouraging people to get tested as much as possible. And let's see, the Stop the Spread testing sites have been extended through December 31st. So through the end of the year, which is great. They've definitely seen a lot of people through those sites. I think it's a great resource to have in this area. We do have our drive-through flu clinic this coming Sunday at the high school from 10 to 2. We highly recommend people come and get their flu shot. We put a lot of work into this, and hopefully it's going to be extremely successful. There are forms you can fill out online to print out, bring with you. Bring a copy of your insurance card as well to attach it to your registration form to make it easier and quicker. We're looking forward to that. So one of the things that I do want to talk to you guys tonight about was the high school. So it's unfortunate. It was a very hard decision. But like I said, what we've been seeing is increased exposures. And with that, we've seen a dramatic increase in close contacts. So people are becoming more complacent. They are going out and seeing more people for extended periods of time. And our contact tracing, our close contact numbers have basically doubled in the past few months from what it was before. But like I said, it's a hard decision, but it's the best because this was pretty far reaching in terms of close contacts. And we wanted to definitely nip this in the bud before it went too far and became more of an issue. One of the things I also wanted to ask you about was I drafted up a mandatory participation in infectious disease isolation, quarantine, and contact tracing regulation that I want you guys to think about adopting at a special public hearing within the next week. I was hoping maybe early next week we could pick a day, anytime that works for you guys, to open a public hearing, read through the regulations. It's only 1, 2, 3, 4. It's only 5 different items in regard to cooperating with our contact tracing, isolation, and quarantine. The state regs that we usually go by don't have any type of fine structure or any type of enforcement procedures for this. So this would give us a little bit of leeway with enforcement if we needed to, just to give it a little bit more teeth. So I had Tony send that out to you guys earlier tonight. You guys should have copies of it. Before the meeting tonight, I would like to maybe pick a day Anytime that works for you guys, I'm here 24/7. So whatever works, let's pick a day, set it up. We'll advertise it. We'll have a public hearing and hopefully pass these regulations. So take a look at what we sent you and get back to me with any questions, comments, criticisms, whatever you guys need. So that is my 2-minute brief update.
Brian, this is Joe again. Received this mandatory participation in infectious disease isolation. This 5-6 step letter here about 6:25 tonight. And B, it says any person who has been contacted by the North Andover Health Department who has tested positive for COVID-19 or been diagnosed with another infectious disease shall isolate, et cetera, et cetera. Another infectious disease, for example, a cold, the flu, they're infectious diseases, but it has here they should be isolated for a set amount of time as determined by the North Andover Health Department. Now, often I've been a board member for many, many years, and often I ask questions because I like other people to give the answer, not that I don't know. But here I'm a little bit confused by this because I haven't spoken with anyone. So are we saying, for example, if you have an infectious disease such as a cold, you have to contact the Department of Health and be isolated for a set amount of time?
Yeah, for different diseases, and there's a whole isolation quarantine state regulation that we enforce. So different diseases or different infectious situations may require different types of or days for isolation and days for quarantine, depending on the incubation period and the infectious period. So that's a blanket statement that if you were doing an infectious disease outbreak of something else, anything from TB, cholera, salmonella, E. coli, there are things that we do with that. In terms of if you're a food worker, obviously you're excluded from your restaurant if you have an E. coli infection or salmonella. So this covers that as well, but it's geared towards what we're seeing right now with the COVID-19 cooperation with contact tracing, as well as if anybody does, and there have been reports across the state through some of the regional groups that I meet with on a regular basis where people are refusing to quarantine or refusing to isolate, or they don't admit they're refusing to it, but then they're out and about all week and the health departments get phone calls saying, I know this person is positive and I saw them at the 99s last night, or I saw them at CVS or grocery shopping when they're not supposed to be. So we have resource assistance for that. If somebody is in isolation and they need help getting food, supplies, we will do it for them. So there's no reason for them to be out and about grocery shopping. We're trying to limit and exclude that as much as possible.
So a hypothetical, a person's not feeling well, he or she is tested for COVID-19, test results come back negative, they still don't feel well. Doctor says, well, you have a cold. Should they contact the Department of Health for isolation?
No, if there's a communicable disease that is reportable, we contact you.
Okay.
We get notified by the state through the same system we're using for the COVID-19 response, is also used for other communicable diseases that we need to be aware of and need to take certain steps after notification.
So this mandatory participation, does this have a state fingerprint on it at all, or is this something that Department of Health?
The state does have their isolation and quarantine regulations, but they advise you to have your own local regulations that you can enforce. Yeah. This is just that step. We've never had to do it before. I think now that we're seeing things and hearing about things across the state, it's a good time to do it. And it's quick, it's easy. It's basically an addendum to the current state regulations that gives us the teeth that we need if somebody does try to violate any quarantine or isolation orders, that we have something to fall back on.
And by the way, go ahead, Patrick. I'm sorry.
Does the Board of Health reserve the right to adjust the quarantine period? Just one example, like healthcare providers. Our regulation is we are allowed to go back to work once, even if we tested positive, once our symptoms have resolved, we are allowed to go back to work because obviously we're needed. Does the Board of Health reserve the right for those types of circumstances?
Yes, those are actually written into the governor's orders.
Okay.
So for first responders and essential personnel, if you're deemed essential, and doctors, nurses, medical professionals, some town officials, fire departments, police department, essential employees, have a clause in there that if you are asymptomatic, you can return to work. Obviously, you have to wear a mask, social distance as much as possible, and do your job as best you can with obviously some limitations. So
Okay.
if you're a critical care nurse and you are diagnosed with COVID, you might not want to be in a critical care unit of non-COVID patients. So,
Okay.
but there is, yes, essential workers do have that ability if they're
Okay.
asymptomatic.
Thanks.
Brian, earlier you reported 13 cases at Merrimack. And now I know, at least I believe that Merrimack has the North Andover zip code, but the dorms are in Andover. Is that correct?
There is housing throughout Merrimack, but some of the dorms are located in Andover. Yeah, I don't have the breakdown of the actual number of rooms in Andover versus North Andover, but they are split. And there are apartments and dorms in Andover as well as in North Andover.
So these 13 cases, they are in North Andover and Andover combined, correct?
Correct.
Because theoretically, they could all be in Andover. But because they're showing as North Andover, that certainly has had an impact on remote learning. And that has to be very difficult for people like, for example, board member Michelle Davis, who has 2 kids in school. Well, it is what it is. By the way, further elaboration on the numbers that you reviewed earlier, looking at an article in today's Boston Globe, 2.56 million people in our state have been tested, almost 50%. And actually, there's been 5.3 million tests altogether, which means obviously some people have been tested 2, 3, or more times. So that's the numbers. The deaths are approaching 10,000. Will be 10,000 sometime next month. As of yesterday, it's 9,559. Really, really scary. So. Okay, other comments on this mandatory participation in infectious disease isolation?
None here.
Okay.
I'm good for any
Brian,
night next week.
You want to have Steve tell us what he's doing and what's happening from his perspective?
Yes, please. Give us a rundown.
Hey guys, so generally speaking, as far as mass complaints go and complaints related to COVID-19, they were pretty low the past month or so. Recently, they've started to kick back up a little bit, which thankfully we got Kalechi in here started today, so he can be able to take care of some of those within the next couple of weeks. But those have started to come about again. It's mainly restaurant employees or complaints about restaurants, which was kind of similar to before. So as far as my kind of schedule goes, it's been a lot of trying to continue some of the normal, or I should say more normal workload, like inspections, so whether it be housing, septic, or anything else. Do plan review guides for new food establishments. We have had some non-COVID complaints, whether they be trash complaints, whether they be housing complaints, things of that nature, in addition to the normal COVID stuff we've been getting. And then we did a Zoom call early in October with Megan Baldwin of Sweet Safe and some of the local restaurants just to kind of go over indoor dining, the guidance put out by the state, and try and get a jump on some of that, just to provide basically a refresher as we start to get closer and closer to winter. We did have another restaurant in North Andover notify us that they're closing, which was Howling Wolf. However, there is another place that is ready to move into that spot, and we're working on getting them up and running as soon as we can. Jointly with Caroline, we ran 2 flu clinics. I helped with one of them. The other they took care of at the senior center. And I've been trying to help out with preparing for the drive-through flu clinic Brian mentioned. That's this Sunday. Saturday, we're going to be checking out the tent they set up. for all the nurses to work under, and then just bringing some supplies over. And obviously Sunday will help basically finish setting up, and we'll work the whole event. And then generally speaking too, per usual, we've just kind of been helping provide clarification and any information on the COVID-19 questions we get from the public, from restaurants and other towns, or in other groups in town. And then Joe had asked earlier too, but I know this is right around the corner too. Halloween is coming, and the Department of Public Health touched on some guidance that basically provided it for Halloween and trick-or-treating. Just to give a quick recap of what they were putting out there. The big thing they were pushing was to keep it outdoors. There's obviously better ventilation. They want basically, to sum up a lot of bullet points they provided, to kind of stick to precautions Brian had touched on earlier, and don't get complacent with certain things. So making sure you're wearing your mask, social distancing from others that aren't in your household, frequent hand washing and hand hygiene, and just avoiding touching your face. Obviously, you want to stay home if you're sick. We can't stress that one enough. And then just some specific ones they had. We're trying to stick to one-way, quote-unquote, trick-or-treating if possible, and grab-and-go candy versus people coming to your door and handing it out. That way you can kind of put an emphasis on social distancing. And then if possible, if you can leave hand sanitizer out for trick-or-treaters, that's great. Parents can also try and bring it with them, use it pretty frequently. And then they also kind of were pushing, this one's more the CDC guidance, but sticking to lower risk activities as possible. So kind of doing stuff around your household, like carving and decorating pumpkins with family, doing virtual costume contests with friends, Halloween movie nights. And then they obviously want you to avoid crowded parties or events indoors, events that exceed the indoor and outdoor gathering guidance. And then obviously participating in activities if you feel unwell or sick is a big no-no. So that was just kind of some of the summary of the points the Mass DPH put out for Halloween. I know that's right around the corner. So,
Brian, are we still phase 3, step 1
Yes, we are.
coronavirus? We've
We
been
are
phase
still
3, step
designated as a
1.
red community, Joe.
Excuse
We're
me?
still designated as a red community. They did change the map this week. Actually, today they came out with a new style of map. We're still red, but there's an asterisk next to our town because we have an institution, whether it's a correctional facility, higher ed, long-term care. We have an institution in town here that has a cluster that accounts for over 30% of our active cases. So, or the case in that 2-week, the 14-day period. So we have an asterisk that at least kind of lets people know that there is a cluster attributed to one location that's kind of contributing to a significant portion of those numbers. So yes, we're still red. We do have an asterisk because of a cluster associated with Merrimack College as an institution of higher ed. So we won't be moving forward to step 2 in the near future. We have to go back down into the yellow designation for a few weeks before we can move up to step 2. I think one thing that I do want to stress on what Steve was talking about with Halloween, we're really trying to encourage people to, if they do go trick-or-treating, to do it safely. If you're going to have a Halloween party, have it outside. The outdoor transmission rate is extremely low versus indoor transmission. They have seen, and they are attributing to some of the spikes that we're seeing to more indoor dining and closer contact inside. So I think that needs to be kind of reiterated to everybody out there listening that indoor parties, indoor gatherings, you're much more susceptible for transmission, either giving it to somebody if you're asymptomatic or getting it from one of your friends who's asymptomatic themselves. So that, and obviously staying home if you are sick. What we're seeing now is a lot of people going out and about, not a lot, but there's a portion of transmission that's been attributed to people not thinking they were sick when they had a headache or a stuffy nose or a sore throat and going out to a sporting event or going to work or school or whatever it is with symptoms. They think, oh, it's minor stuffy nose. I feel a little drowsy, a little fatigued, but it's not that bad. And it turns out they test positive 2 days later and may have infected a handful of people while they're out and about. So staying home if you're sick is extremely important, as well as indoor gatherings and being cautious and being smart about it. So Halloween parties, try to keep them outside as best as possible.
Thank you. Anything else from the members of the Department of Health?
Let's pass it off to the board and see what you guys have to add in.
I certainly would like to know what our doctors have to say. So, Max, Patrick, it's open to you.
I'll flip a coin. Max, do you want to go or you want me to go?
Patrick, you go ahead. You have seniority.
Thanks. So I actually have to say that over the last month, there in my hospital, there definitely has been an uptick in cases, but the severity of illness has definitely dropped significantly. As a matter of fact, our ICU hasn't seen any COVID patients in the last month, but there have been a fair amount admitted to the hospital. And there's been actually a couple of recent studies that looked at this, and there has been a trend towards less severe illness over the last few months. I'm not sure what that is attributed to, whether it's a less virulent strain, which I doubt. Treatments, I don't really see anything as far as treatments that have been glaring, that have been profoundly changing the severity or the course of the disease. You guys probably have saw that the FDA approved remdesivir formally today, even though we've been using it for a fair amount over the last 6 months or so. The remdesivir has not been shown to decrease mortality with COVID. It has only been shown to decrease the symptoms. There was a WHO study of about 11,000 patients with remdesivir. That's where the no change in mortality came from. But there were several studies from Gilead, or sponsored by Gilead and the National Institute of Allergy and Infectious Disease, that did show that it decreased symptoms. So it's really that and steroids have been the only thing that have shown to decrease symptoms, and the steroids, there has been a trend towards decreasing mortality overall from the virus. I know, Joe, you wanted us to talk about symptoms. I think symptoms have kind of been beaten down as far as what can be exhibited. Really, it's anything and everything has been pointed towards it, from anosmia, which is the lack of smell, to headaches, to fevers, to body aches. Unfortunately, it is very non-specific. So really the broad statement is, if you have any type of symptoms, just get tested. That's kind of my 2 cents on things, and get the flu shot. That's my 2 cents on everything. Max, I'll let you chime in.
So Patrick, you took all the low-hanging fruit, I must say. So
Hey, it's seniority.
Like apple picking at Small Licks.
Seniority has its perks, right?
So I work at 2 of the local community hospitals here. I work in Lowell and I work in Lawrence. And we have also seen in both of those hospitals an uptick in the number of cases. I have seen patients in the ICU in both cases, in both hospitals rather, who have had COVID, and the demographics of people who are getting COVID are unchanged from what they were before. There are still some things that put you at higher risk of having a worse run with this thing. Being older and having other associated diseases like diabetes, and being overweight or obese are some big issues that can occur that can make you more apt to have a rockier run with this. Just on a sort of a more personal note, one of the things that when we moved to North Andover over 10 years ago, one of the things that we noticed more than anything else was the pride that the people have when they live in this town. They wear it on their chest. They attend sporting events even if their kids don't play. They coach other kids. That people are really invested in this town. And the one thing which I have seen in terms of that town pride is that the best way to demonstrate that is to do what is best for your whole town when you live here. Listen to the guidelines. Listen to the recs that Brian has given. They're really pretty straightforward and common sense. And if we as a community can implement them, then we'll be a much healthier community in the long run. So that's just my little sound off.
Awesome. Thanks, Pat.
Thank you. Pat, you mentioned early remdesivir. It's just been approved. That's one of the drugs that that President Trump was given, which probably all of you know, as well as dexamethasone, if I'm pronouncing it correctly, and quite a few others. And he seems to be doing okay right now. So even though this pandemic has been brutal, the drugs seem to be getting better all the time, and as such, the percentage of the people that come down with the virus that die it continues to go down too. So that's good news. That's very good news. Michelle, with this virtual schooling, how's it going with 2 children in our public schools?
Well, mine are in elementary and middle, so we will, for the time being, continue to be a hybrid model. And I encourage the rest of the community, like you just heard, to please do the right thing so we can stay in that setting as long as possible, and hopefully get the high school back as well. So it's going well. I continue to be impressed by the town, by the communication. Obviously, the whole town struggled at the end of last week, was over the weekend and the beginning of the week, with the outages of email and internet and all that stuff that happened town-wide. But I think everybody handled it well and we all got through it. But it's going pretty well. I mean, I think that the kids are just really happy to be able to get some days in school. I think they're adjusting better than you probably would expect them to, but they do a great job adjusting. And I'm hearing great things about all the teachers getting them outside as much as possible. To Brian's point, there's tents, they bring them outside, try to do mask breaks outside. I've heard about the practices of giving them opportunities to change out their masks during the day, lots of hand sanitizer and cleaning, and have been totally impressed too with the town's commitment to the food and nutrition of our town. And for those who aren't aware, it has just been incredible. Whether you are in school, in a hybrid, whether you are OLA, no matter what, you can show up any day of the week at the high school and pick up breakfast and lunches for your children. No questions asked, free of charge. So the food and nutrition commitment to making sure that every student in this community is getting nutritious breakfasts and lunches is just incredible. And, the schools do put out, as kids are leaving, lunch and breakfast for the next day that they can take to go. They're providing meals for the weekends. So if you know anybody or if people aren't aware of this, please spread the word, because I think the town's doing a great job, but I think it's probably underutilized by people who need it.
Thank you. And speaking of food, Daphne, are you still able to provide food for needy citizens during this pandemic? I know that has been a focus that you have, and you've done a great job in that so far. So what's happening right now?
Hi, Joe. How are you? And yes, we actually had the opportunity now to get fresh produce, not sandwiches, to the town. I know we have a commitment for the senior center as soon as they're able to have clearance, because they had flu shots and so forth. So we're able to get milk, eggs, what else do we have in the bags? Oranges and so forth, meats every week. So definitely we have that available until further notice. So we just need transportation, and I thank you for volunteering as tribute to do pickup.
And speaking of the food distribution, that the senior center is off or not available right now for a number of reasons. Obviously, we have the flu clinic there, and is that what the early voting is at our senior center right now? Brian, would you know that?
Yeah,
it is.
Yep.
So it's really not available at this particular time, but hopefully it will be available soon. And while we're talking about the corona virus, I read, and it was a couple articles in the Wall Street Journal and the Boston Globe. There's a Pfizer vaccine Well, Pfizer is conducting a late-stage clinical trials and plans to seek emergency use authorization in late November. So 4 or 5 weeks or so from now, there may be a vaccine that is available for emergency use. Very, very interesting. A couple other things I want to bring up too.
Hey, Joe,
Suicide.
if I can make a quick point about the vaccine, I definitely have to say that I have had a fair amount of patients who have asked me about the vaccine and the safety and efficacy of a vaccine when it comes out. And I've had a fair amount of patients been resistant to the idea of taking a vaccine. And I just want to kind of reassure everybody that these processes are not being rushed. There are specific scientific reasons why we were able and lucky enough to get a vaccine to trial so quickly. Number one, they were able to isolate the virus rather quickly. So I just more so just want to reassure everybody that when a vaccine does come out, it is a safe vaccine.
Thank you for saying that, Patrick. Unfortunately, the vaccine has become political. And after the election results are in on November the 3rd, I think it's going to be less political at that time. But because it is so political, there is a substantial segment of the populace that will refuse to take it, even though it is safe. It will be tested, and that is quite disturbing. Max, Patrick, you may want to further comment on that, but that's what I read. But then again, I read a lot of different things, and often there are different positions, but it is political at this particular time, unfortunately. I wonder if we're done talking about the COVID-19, a couple other things I'd like to bring up. I'm looking at an article.
Things, Joe.
Oh, I'm sorry. Go ahead.
That's okay. Just to touch back upon the high school. Obviously, there's a tough decision. We're hoping to get everybody back into school after this little 2-week hiatus. The other schools are still safe. They're still in the in-person hybrid model at this point. And one of the reasons why I wanted to touch back on this is I just got some updated guidance from the state. This literally just came out about 20 minutes ago. It is an order of the Commissioner of Public Health regarding the operation of indoor ice rinks and indoor skating and hockey facilities. As I've said, we've had some outbreaks and some clusters. A lot of it has been attributed to sports. Hockey has been one of the main ones, and we've been eyeing this for a while. We've quarantined 4 hockey teams over the past couple of weeks. It's been a problem throughout the entire state. So one of the things they did as of today, 20 minutes ago, they just released a ban on hockey and skating rinks. Beginning October 23rd, 2020, and ending 12/01 on November 7th, 2020. So for a few weeks, I think they've seen so many outbreaks and clusters associated with hockey rinks that it's been a problem. So let's see. So it says that they have had clusters of 2 or more confirmed or probable COVID-19 cases, totaling 108 confirmed cases in more than 225 exposed contacts. There's at least 1 hockey-associated case of COVID-19 in 66 cities and towns in the Commonwealth. For 2 weeks, the following 180 cases among 23 different hockey teams has put a lot of people and has caused a lot of issues in other communities as well as ours. So one of the things that we've seen here is issues with the hockey rinks and hockey teams. There's different theories on this, and I'd like to toss this to Dr. Scanlon, Dr. Tilson about maybe why they think that is. There's been discussions in the public health community about the cool, dense air in a hockey rink doesn't flow or move as well as, say, like a soccer field. You're enclosed, you have boards, you have glass, you sit on a bench, you go out and you skate really hard for 1.5 minutes, 2 minutes during a game, then you sit on the bench and you huff and puff and then do it all over again. So there's talk about that. There's talk about locker rooms. There's talk about off the ice gatherings and activities. Not team sponsored, but hockey players are always friends. They always do stuff together. So that might be part of it as well. I'd like to get your take and see if you guys have seen anything or heard anything about that. I know New Hampshire has already banned hockey and rink activities for 2 weeks. They did it this past week, I believe. I don't know if Pat seen anything up there in regards to hockey or.
I think Nashua was a big cluster with hockey teams up there. I played hockey growing up, so I can definitely see why this is a very high transmission rate indoors. Yes, the dense air, you're breathing very heavy. The benches, everybody's close to each other on the benches, and you can't really social distance on the benches because the benches are really just a small area on each side of the rink. And I'm not surprised by that at all.
Yeah, so this literally just came out at 7:23. I got an email. This basically hot off the press. I've been told that the state has been looking at this very, very closely for a while because a lot of these outbreaks. I actually played hockey growing up as well. Love the sport, but I can remember sitting on the bench, huffing and puffing, going out, skating as fast as you can for 2 minutes, and then coming back to the bench and doing it all over again. So it's unfortunate, but I think with things like this and clusters and small little outbreaks we have, this is going to start to happen. So I think with the high school being shut down is a perfect example of people doing things outside of school. Schools are extremely safe. You're socially distant with your desks. You have your masks on. Everything is cleaned every night. There's a lot of there's nobody's using their lockers anymore. You eat lunch at your desk versus in a cafeteria. So they've done everything they needed to do to keep the school safe. It's outside of school and the sleepovers and parties and gatherings that are causing the problems. So just wanted to reiterate and circle back around to that because we need to keep this under wraps and keep it in control to get the kids back into school. And I think that's the goal of everybody is to keep the kids in school and learning. I think it's extremely important.
Brian, how many ice skating rinks are there in North Andover?
We've got a few. We've got Brooks, we've got Merrimack, and we've got Microweiss. Microweiss is a small, like a learn to skate or training rink versus a full-size hockey rink, but we have 3. Merrimack has 2, so I guess that's 4.
Brian, I have a question about the high school. Where are the gatherings happening? Are they like right after school?
Houses, parties, typical activities after school and on the weekends. Night.
So the purpose of going remote for 2 weeks is just to help disperse this cluster, let everybody regroup, and then resume again.
With the sporting things we've seen in the past week, 2 weeks, and now this latest outbreak is attributed to a couple of parties. So it's starting to spread, and we needed to kind of nip that in the bud.
Has the board been notified of any specific parties because I know last month you mentioned about certain students at Merrimack College were fined. Is the board going after certain houses?
Yes.
Okay.
We're working on that now.
Okay.
Absolutely. There was another one at Merrimack too that I will be drafting up more notices on hopefully tomorrow, if not at the beginning of next week. We have a total of 16 of them. So it might take me a little time to get that done.
Other comments on the COVID-19?
I just would say that the fact that Merrimack College has dropped their cases as precipitously as they have showed that this kind of very forward-thinking, aggressive action works. If you do it right and you believe in it and everyone plays by the rules, it works as long as everyone participates in it.
Yeah, what were they at max buying? About 88 at Merrimack College?
It's a sliding scale, Joe. The way it works is you have people coming onto isolation and that test positive every day, and you have people dropping off every day. So it's a sliding scale, but they were up there. That one peak in the one dorm had into the 80s, maybe been a little bit more with some of the other students. And because they have students, faculty, and staff and vendors that they test every week, regardless of who you are, where you are. If you're on campus and you're there, you're getting tested. So you can't attribute it all to one dorm, but that peak was a major spike in one dorm, plus some of the ancillary testing positives they get on a routine basis.
Several other things, items I'd like to briefly comment on outside the COVID-19. And it's interesting, last year, by the way, at this time, the focus was on e-cigarettes, or how things changed. But there's an article in the Globe on suicide prevention. And there was a new federal law that designates 988, the national phone number for mental health emergencies, that will take effect in July 2022. And until then, the existing number is 1-800-273-TALK. And I bring that up because the side effects of this isolation, they're bad. And I think that in many respects, they're only going to get worse. There's been an uptick in suicide rates, but then again, I read that that is not the case. So I really don't know. I'm only commenting on what I read, and sometimes I read things that are inconsistent with other things that I read. Also, too, and as I said, I want to talk briefly about items outside the COVID-19. Purdue Pharma, they've been fined $8 billion. Of course, they're in bankruptcy right now, so they're never going to pay it. But they are a marketer of OxyContin, and I had read, well, the high number that I read is 450,000 opiate deaths, which is twice the deaths from COVID-19. Interesting. Brian, a couple other questions for you. Mosquitoes, it's been a good year in North Andover. Further comment?
It's been a great year for mosquitoes. Very low numbers all season. And we've had a frost already, so I think we're pretty good.
Okay. And how about the septic system? This is also a major topic of discussion before the COVID-19. The permits, any problems with issuing them? Because due to the winter and the cold weather, there are not going to be many inspections or repairs or replacements. So are we on top of that right now? Are we in good shape?
We are. We actually shut down our season for installation of septic systems in about a month. So plan reviews are due in within the next few weeks. If they're not approved within a few weeks after that, they don't get installed this year. So they have to have a plan approved by November 15th prior to them getting installed, which is a deadline of December 1st. And we are done for the season. Obviously, if there's an emergency, we have emergency certifications for new systems going in, depending on the situation, extreme failures, backups, things like that. So there's still things that we can do if something does arise that needs to get taken care of immediately.
Okay. And as I said earlier, a major topic of discussion last year, this time was e-cigarettes. Where do we stand with marijuana distribution in North Andover, e-cigarettes, and so on? Brian?
E-cigarettes, you guys removed from convenience stores and gas stations when we updated our regs last year. We only have one licensed smoke shop, but I don't believe they're in very much operation because the state also banned any flavored pods or tobacco. So they don't really have a product to sell at this point. I believe the adult-only tobacco store we have in town is looking to go into a more of a convenience store setting at this point because the market really isn't there at this point. So that's been very successful at the state level and local level. So hats off to you guys for doing that. I think that was a bold step, and you guys definitely progressive in doing what you did last year, and I think it's paying off.
And one final comment. I had read that there are dual flu shots available, particularly to people 65 years of age and older. I don't think that we give that in the town of North Andover. Brian, do you know anything about that? How about you, Max, of Patrick?
I'll pass off to the medical professionals for that one.
I'll let Max
Anyone
answer this one.
Anyone hear about the dual flu shots?
So, Patrick, I was hoping that you were going to answer this.
I'll tell you that. I can take it if you want.
Go ahead.
Yes, there is a 65 and older flu vaccine. I do not know whether or not North Andover is offering that, but any local pharmacy, there was a back order on that vaccine recently, but I believe most pharmacies now have it back in stock. So anybody over the age of 65 should get the 65 and over vaccine. It is for the lack of a better description, a slightly more potent vaccine to generate a better immune response for 65 and over. So again, I encourage anybody over the age of 65 should get that, and that's available at any local pharmacy or your primary care doctor's office.
I had read that it's
or your
a
friendly pulmonologist.
I had
And we
read
do
that
have
I'd read that it's a dual flu shot, and which to me means two. But then again, I got that information from the Boston Globe, which I question their accuracy most everything anyway. But it says dual flu shot, so that means two to me. But I don't know.
So it basically what it's doing is you're covering the most common predicted strains for the year, and I believe Brian knew exactly. I know H1N1 is one of them this year because I saw the vial, but I think Brian would probably know the other ones that are on the flu vaccine this year.
I don't remember them off the top of my head right now. I know H1N1 is on there. It's quadrivalent high dose flu shot, and we did have those at the senior center clinics we had already, and we do have some available left for our clinic on Sunday.
Excellent.
Any further discussions? If not, need a motion.
Can I just ask one question about how the numbers of the flu clinic is looking for Sunday?
How the numbers are looking? They're looking really good. We're going to be open from 10 to 2. We've got a good chunk of people already pre-registered, but we do have plenty of vaccine, and it's going to be a quick throughput. We're going to have 12 vaccinators, 6 lanes of drive-through, and we have plenty of volunteers, and we've got a really large circus tent you're going to drive through. It's going to be great. So definitely come on through, bring your kids, and it's going to be fantastic.
I'm volunteering. I'm one of your volunteers.
So we've got 100 people already pre-registered. We have 100 cards pre-registered.
Oh, that's wonderful.
Yes. So hopefully there are multiple people in each card, and we can get rid of all of our flu vaccine on Sunday.
Great.
Is this a good dry run for what's to come in a few months?
Absolutely. That's why we're doing it. It's actually it's a drill that we're doing through our regional EDS plans. So we have emergency dispensing site plans. One of our plans is a drive-through, so we are actually testing a plan that we have in place already for this exact situation. So we'll see how this works. It's the first one. Yeah.
Anything else?
A few months.
Anything else from anyone?
No, just to thank you again. I feel like you guys, like you said, Brian, you're working days and nights, and so glad to hear that you're getting additional support across the department, so that hopefully you guys can all take a break and have some self-care time. And I hope that you all are taking some time to make sure that you're taking care of yourselves as well while taking care of others.
Thank you. I appreciate that.
Yeah, that's one area that there was a consensus of opinion. That is, you and your department have done a very good job. So keep up the good work.
Thanks, Joe. And
if that's it, need a motion. If you don't know what the emotion is, it's for adjournment.
We're going to let Max has to make the emotion.
Well, I motion to adjourn.
Is there a second?
Second.
Okay. All those in favor say aye.
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 Those opposed say no. Motion is passed. Thank you and have a good evening.